Now, the Democratic Republic of the Congo hopes to receive its first doses of an Mpox vaccine by next week to help contain its rapidly spreading outbreak. The Africa CDC says African countries have recorded 18,910 Mpox cases and 541 people have died this year alone. Most of the cases are in the Eastern Democratic Republic of the Congo. Japan and the U.S. have pledged to send vaccines, but it is far short than what is needed. The Africa CDC says African countries require 10 million Mpox vaccines, but only 200,000 vaccines are currently available, even though the disease has been endemic for decades.
Despite these efforts, we are facing significant challenges. There is a critical shortage of testing, treatment, and vaccines across the continent. These shortages are severely hampering the ability to contain the outbreak. We are calling for urgent international support to increase access to vaccine stocks and treatment options, and to scale up testing and alert investigation. Without these resources, the epidemic will continue to spread.
Dr. Bharat Pankania is a senior clinical lecturer at the University of Exeter Medical School. He joins me now live from Bath in the United Kingdom. Doctor, great to see you. Great to have you here with us on TRT World. So how are we going to do this? Mass vaccinations or targeted vaccinations?
We may have to do a bit of both. I don't think mass vaccination at this point in time is needed. And my reasons are vaccines, as your report has just indicated, are in short supply. So a better use of the vaccines that we have would be targeted vaccination.
And, you know, we heard a senior official from the World Health Organization say this earlier, that this is not going to be COVID-19. I wonder why.
Well, I totally agree. There are a number of factors. One, this is a known virus. Number two, this is not an airborne virus. Number three, this is something we know how to manage and deal with, and we've got vaccines against it. So putting all those factors plus a few others, one can conclude quite confidently that whilst we will have an epidemic, meaning lots and lots of cases, this is definitely not the markers of a pandemic whereby it sweeps across the world and causes lots of illness and many deaths.
Dr. Pankani, you know, when the World Health Organization declared an international emergency, international alert over the outbreak of Mpox, there was a lot of panic among the masses. I mean, I remember speaking to some of my friends, and of course, the one question that was on everyone's mind was, are we heading into another pandemic? And like you also said that it's very unlikely for Mpox to turn into a pandemic. Then tell me, do you think this was blown out of proportion from the World Health Organization's perspective?
No, not at all. In fact, I would say the World Health Organization acted in a very timely manner. Look, the situation is as follows. Whilst it is Mpox is endemic in the Democratic Republic of Congo, we've got cases in 16 other African countries, and not only 16 other, but we've got a new branch, we call it clade, a new branch of the Mpox virus, which is more infectious and more disease causing. And in view of the fact that it was spreading and spreading fast in many countries, declaring a public health emergency of international concern opens the gates. It opens the gates for Gavi, which is a vaccine supplier, opens the gates for donations, opens the gates for United States, United Kingdom, European Union, and others to focus on helping this public health emergency. So I would say it's a good call.
Okay, now, Dr. Pankani, I just want to use this opportunity to ask you some very critical questions, which I believe are on a lot of people's mind at the moment. First one, I live in a country where there's no outbreak of Mpox. How concerned should I be?
Unfortunately, we will have sporadic cases, and they could turn up in any part of the world, anywhere. And, you know, it starts off with from animal to humans and then from human to human. So this is the reason, this is actually the very reason why I say help Africa control and contain it and hopefully you won't get a headache in your own country. Because if you have a headache in your own country, it's a lot more expensive to treat. Therefore, it is in the interest of these rich nations to make that donation to keep that outbreak in Africa.
Okay, now the second question here, and I'm sure many must be wondering this. Do I need a vaccine?
No, not at all. So if you are not in the at-risk group and vaccines are in short supply, I would not be giving universal vaccines to travelers, holidaymakers, or people who are just the worried well.
Dr. Bharat Pankhania, it's always a pleasure talking to you. Thanks very much for talking to us here on TRT World. I really appreciate your taking out the time.
Thank you.